Hi everyone, today I'm going to be talking about the repressed and recovered memory controversy. First of all, make sure you read myth number 11 from the 50 Myths book first, which generally discusses some flaws with memory. Additionally, it might help if you also think of a time in your life when you recalled something important incorrectly, or when you forgot to do something that was important, or when you recalled an important event differently than a friend or family member, meaning that one of you has a faulty or incorrect memory of the event. Basically, we can all think of at least one time in our life when our memory has let us down, demonstrating that memory is not perfect and mistakes with memory are made all the time. So today's topic is going to be a sensitive one. Specifically, do recovered memories of childhood abuse correspond to real events when they are spontaneously first remembered during adulthood? So specifically, what we're talking about today is whether people who spontaneously first recall memories of childhood abuse for the first time during adulthood, especially while in therapy, are they recalling true memories for events that actually happened, or are they recalling false memories for events that never actually took place? First of all, during this discussion, please remember the policy on reporting childhood abuse from the syllabus, that if you discuss an incident of personal childhood abuse on the discussion board, via email, or to me personally, I am required by law to report it. I also want to make it clear what we are not saying or disputing when we're talking about this topic. So we're not saying that the accounts are intentional lies. We're not saying that the person isn't suffering emotional pain. We're not saying that childhood abuse does not occur or that it isn't tragic when it does occur. We're not saying that all recovered memories are made up or false. And we're not disputing the accuracy of memories for childhood events or childhood abuse that people have always held. What we are saying is that many of these cases come after repeated suggestions by a therapist and after the use of certain therapeutic techniques. So although we always want to believe people, believing false claims of abuse can damage innocent people, such as the parents, and even the person falsely remembering the event if they alienate themselves from their loved ones because of these false memories. These techniques that we'll talk about today have been shown to lead to memory for false information. So think about if a police officer used leading questions to obtain information from a witness or a suspect. We would expect those memories to be less genuine or trustworthy than if the police officer didn't use leading questions. This is the same idea here. If a therapist uses techniques that we know cause false memories, will we really be surprised if some of the memories uncovered during therapy using these techniques turn out to not be of real events? And then we're also saying that it's incorrect to think our memory captures and stores all events perfectly, like we talked a little bit about already, and like you'll read about in myth, or like you've read about in myth number 11. So it's in our best interest to use critical thinking when examining this topic. The way I'm going to structure this PowerPoint is similar to the way that you're going to write your paper. That is, I'm going to present the topic, which I've done. Do recovered memories of childhood abuse correspond to real events when they are spontaneously first remembered during adulthood? Then we're going to look at two competing claims. The first claim is that they do, that memories for traumatic events are repressed and then retrieved during adulthood. We're then going to discuss some evidence that supports this claim and examine the quality of the evidence for this claim. Then we'll discuss a competing claim that many of these memories are false memories. And we'll present evidence for the second claim, and then we'll compare the evidence for these two claims. So let's start by presenting the two claims. Claim number one is that people can repress and later recover memories for traumatic childhood events. That is, they can forget them during childhood, but later be able to recall them as adults. Repression is a Freudian idea. According to Freud, childhood traumas such as sexual abuse could be pushed out of awareness, resulting in various symptoms like depression, anxiety, and sexual problems as adults. In other words, the way children deal with traumatic events is to forget or repress them, but this causes psychological problems as an adult that a person might eventually seek therapy for. Many therapists agree with this claim. Some have written that, quote, half of all incest survivors do not remember that the abuse occurred, or, quote, millions of people have blocked out frightening episodes of abuse, years of their life, or their entire childhood. The second claim is that some of these repressed and recovered memories are false memories, that as adults, people formed a memory about childhood abuse that didn't occur. What it is saying is yes, some of these recovered memories probably do correspond to real events, but many or even most of these memories are not authentic. We'll discuss the evidence to support this claim after we look at claim number one. Anyway, to illustrate the need to think about this topic of repressed and recovered memories critically, let's briefly talk about the case of George Franklin. George was accused of murdering his daughter's friend, Susan, while she was a child. There were other similar cases reported at around this time, during the late 1980s to the mid-1990s. In this particular case, there was a girl named Susan who was murdered, but the police were never able to identify the perpetrator. George's daughter, Eileen, claimed to have witnessed the event, but did not recall it until 20 years after it took place. Again, Eileen did not recall all of the details right away. Instead, she supposedly had a spontaneous memory of the event 20 years after it occurred. So 20 years after Susan's death, Eileen described to the police how her father, who was supposed to be driving them to school, instead drove her and Susan to a wooded area and then raped and murdered Susan. Ultimately, the detectives believed Eileen that she was telling the truth, and George was arrested. George was eventually convicted of first-degree murder in 1990 and served 6 years in prison before being released. There are some sketchy details about this case. Eileen's memories fit with what was reported in the newspaper about the case, but they lacked some details that weren't reported. And it eventually came out that Eileen's memories were recovered through hypnosis, and memories recovered through hypnosis are inadmissible in California. So in the end, George was released from prison. If you want, you can get more information about this case by visiting the website at the bottom of the screen. But anyway, this case was one of the first cases of its kind, and many like it soon followed. Here you have perfectly normal people swearing in court that as an adult, they came to remember that their father or mother or some other loved one did something horrible when they were younger. They have no reason to lie or exaggerate. Like I said, they were often implicating a close family member. And juries found this testimony to be very convincing and frequently voted to convict. So we're left with a dilemma that demands critical thinking. If we conclude that these recovered memories are authentic, then we should treat them like any other memory and act accordingly, including convicting the accused person of the crime if there is enough evidence. However, if we conclude that memories people spontaneously recall during adulthood for an event that happened during their childhood are likely false memories, then believing that they correspond to real events will lead innocent people to be sent to prison. Accordingly, let's examine the evidence for our first claim that these repressed and recovered memories do correspond to real events. So the first piece of evidence to support the repression claim, to support claim number 1, is that people have lots of unconscious memories, ones that are outside of their conscious awareness. One assumption of this claim is that people have unconscious memories. In human learning and cognition, we talk about non-declarative memories, such as procedural memories, which are memories for things like riding a bike or tying your shoe. So when you ride your bike, do you consciously think about how you balance, or do you consciously think about the steps involved in tying your shoelaces, or the location of the keys on a keyboard when you type? Well, no, probably not. These memories are outside of your consciousness, but they can still affect your behavior. So this assumption of the memory repression claim is true. We don't have conscious access to all memories. Another piece of evidence to support this claim is that there are case studies or anecdotes of individuals who reportedly completely forgot about a traumatic event and later were able to recall it. In one study, the researchers looked closely at 4 cases where they attempted to show that the memory was real and that it was forgotten for a period of time before being spontaneously recalled during adulthood. I'll just describe one of these cases, an individual by the initials JR. One night, he went to see a movie where the main character struggled with memories of sexual abuse. During the movie, he felt agitated and uncomfortable, but he couldn't understand why. Later that night, he remembered an experience of sexual abuse in great vividness that occurred to him when he was younger. He said, "If you asked me before the movie if I was abused, I would have denied it unconditionally." But the abuse was later corroborated by the offending priest. Another example of these sorts of studies is of a longitudinal study of 129 female children who were brought to a hospital emergency room for treatment of sexual abuse. When they were interviewed 17 years later, 38% of them failed to report the original incident. Third piece of evidence to support the repression claim is that there's evidence from experiments that people can intentionally or unintentionally forget information and later be able to recall it. This evidence centers around the concept of memory blocking, that certain memories can be blocked from conscious recall for a time and later recalled, which is conceptually similar to a repressed and recovered memory. The first good example of this is the tip of the tongue phenomenon, which is the intense experience that a sought-after word is known but cannot be immediately thought of. So has this ever happened to you, where you try really hard to think of a word that you know, but you can't think of it at the moment, but later on you're able to recall it? When it happens, it probably seems like you can remember some information about the word, like the initial letter or the approximate number of syllables of the word, and yeah, later you do recall the word, so you know the word, it's stored in your memory, but it just can't be recalled for a time. So this is conceptually similar to a repressed and later recovered memory. In studies of motivated forgetting, they show that intentionally forgetting some information leads to impaired recall of it at a later time. In one study, participants viewed movie clips, and some were told to forget information about the movie, but not information about the context of the study. Compared to a control group that wasn't given these motivated forgetting instructions, more forgetting occurred for the movie in the experimental motivated forgetting group. In another study, participants kept a diary for 2 weeks. Those in the motivated forgetting group were told to forget anything that happened to them during week 1. Later, when participants were asked to recall events from their diary, those in the motivated forgetting group recalled fewer details from week 1 than those in the control group. And then in free recall studies, participants recall fewer negative than positive events. So in studies where participants are just asked to recall as many experiences or events from their lives as they can, the subjects tend to recall fewer negative than positive ones. This is consistent with the notion that people naturally forget painful, traumatic events, but can still remember happy ones from that same time period. So next we're going to evaluate the quality of the evidence that supports claim number 1. And remember, you should be doing the same thing for your paper. You present the evidence for claim number 1, and then you evaluate that evidence. So one thing that's worth mentioning is that case studies and anecdotes don't provide good quality evidence. For example, they have low generalizability. We talked about many limitations of case studies and anecdotes in this course, how the example could be unique and doesn't always generalize to others, that they leave lots of other variables unaccounted for, or that the report of the event may be wrong. So even if we accept that there are some valid examples of repressed and later recovered memories, that doesn't mean that every case is valid. That is, yeah, maybe we have these 4 valid cases, but does that mean that the majority of cases are valid? Not necessarily. Another thing that's worth pointing out is that failures of retrieval do not necessarily mean that the memory was repressed. It could be regular forgetting, people not wanting to discuss a traumatic event, etc. So think back to the longitudinal study on the patients not discussing the abuse with the researchers. It may have been that they just forgot about the event or that they didn't want to discuss it with the researcher, not necessarily that they repressed their memories. In one study, a group of researchers interviewed 175 people who suffered documented childhood sexual abuse about 13 years after the incident. 16% of the people didn't report the incident during a phone interview, but after a face-to-face interview, only 8% didn't report it. So, those extra participants who only reported the abuse during the face-to-face interview clearly remembered the abuse during the phone interview as well, but they just didn't want to talk about it. So again, a failure to report something doesn't mean that the memory for the event was repressed. The same thing is true with those laboratory studies on motivated forgetting. There's no reason to think that people repressed memories of those events. It could just be regular forgetting. That is, people sometimes forget things, especially if they want to, or if you tell them to, they can even forget traumatic events. And sometimes information that is forgotten is just later recalled. There's no need to assume that there's some special mechanism like Freudian repression that's responsible for people not being able to remember traumatic events and later being able to. It can be explained just fine through well-understood regular processes like forgetting. Next, traumatic events tend to be highly memorable, not easily forgotten. For example, think about people who suffer from PTSD following traumatic events. They have trouble forgetting the traumatic event, not difficulty remembering it. This is especially true for children. For example, child Holocaust survivors, for the most part, clearly remember the events. They don't repress them, right? They show flashbacks, not repression. This casts doubt on the validity of these recovered memories, as again, such events tend to be easy to remember, not easy to forget. And then finally, childhood amnesia is a natural, common experience. The idea here is that some therapists take the fact that a person can't recall events that took place when they were young children as evidence that they were abused as a child, and thus they had repressed their memories for that time of their life. But let me ask you, think of the earliest event that you can remember from your childhood. Not the earliest event that you are aware of, but that you can actually remember. How old were you when that event took place? If you're anything like the students in my face-to-face classes, you're probably 3 or 4 or even 5 at the time of your first memory. So, childhood amnesia is a natural common experience, and childhood amnesia is just the inability for people to remember events from when they were younger than 2 or 3. So it's common for people to not remember events from early in their childhood. It doesn't mean that someone suffered a traumatic event and repressed their childhood memories during that time. It's just a normal part of memory. The likely cause is that the brain simply isn't fully formed yet at this time, so forming long-term memories is difficult, and a lack of language skills at that age also makes forming memories difficult. Next, let's turn to claim number 2, that some of these repressed and recovered memories are false memories, that as adults, people formed a memory about childhood abuse that didn't occur. Remember that we're not talking about memories of abuse that people have always had, but rather when they spontaneously remember incidents of childhood abuse for the first time during adulthood. And to bring this back to the paper, in the next section of your paper, you would restate claim number 2, which we just did, and then you would present 3 pieces of evidence to support it, which you're going to be doing over the next couple of slides. So the first piece of evidence is that distortions of memory are numerous and common, which demonstrate the existence of false memories. So yes, this is just saying that memory is not perfect, right? Think back to myth number 11. Memory is not perfect and is often reconstructed. It includes pieces of accurate information as well as false information that fits your schema or understanding of the event. Also remember at the beginning of the PowerPoint, I had you think of a time when your memory failed you. That's the point that we're making here, that memory is not perfect and instead people experience false memories regularly. A second piece of evidence is that participants in laboratory studies can be made to recall emotional false memories from childhood. In one study, participants who visited Disneyland when they were younger were asked whether they remembered seeing Bugs Bunny there. Of course, Bugs Bunny is a Warner Brothers character, and so he would never be at Disneyland. But some participants were given doctored Disneyland brochures that showed Bugs Bunny at Disneyland, and the people who got these brochures were more likely to falsely remember seeing Bugs Bunny at Disneyland when they were children. Probably the most famous example of implanting a false emotional memory in a person is the Lost in the Mall study. In this study, a participant was told by his brother, falsely, that when he was a child he became lost in the mall. At first, the participant did not recall the event, as it never actually happened, but after being asked repeatedly to remember the event, he began to remember false details. That he was scared, that he was asked by an older man in a blue flannel shirt if he was lost, and he even remembered the toy store he was outside of when he realized he lost his family. Ultimately, he rated this false memory as being more vivid than over half of the other real events in his life that he was able to recall. So the point of this study is that even emotional memories can be false ones for events that never actually happened. Next, hypnosis, guided imagery, dream interpretation, and multiple questionings are common therapeutic techniques to uncover repressed memories. The first 3 are meant to help the person access the information in their unconscious where repressed memories are supposedly stored. Guided imagery is like hypnosis. The person is instructed to close their eyes and relax, and they're given imagined scenarios to develop and form mental images of. In one survey of about 200 licensed doctoral-level psychologists, 3/4 of them reported using at least one of these techniques to help their clients recover memories, and 25% said that they regularly use 2 or more of these techniques. Now, the reason this is a problem is because in experiments, these techniques have been shown to increase the rates of false memories. In one study, for example, the parents of participants completed questionnaires about events that happened to their child during their childhood, such as going to the hospital, a family vacation, or a particularly eventful birthday party. The researchers asked the participants to tell them about these true events as well as a made-up event, that when they were little, they spilled punch on the parents of a bride at a wedding. Participants were told that these events, including this fake one, were events that their parents said happened to them when they were children, and they were asked whether they remembered any details about these events in 3 total sessions. So here are the data. First, looking at the data for the control participants. On the left side, we see the percent of participants who recall the true events, and on the right side here, we have the percent of the control participants who falsely recall the made-up event. So we can see that a few remembered the completely false event, especially by the third time they were asked about it. Next, we have the data for the guided imagery condition, where remember, participants were asked to form a mental image of the event, and then were asked if they remembered any details about the event. As you can see from the data, the use of guided imagery greatly increased the rate of remembering the false event, and this was particularly true during the second and third interviews. The issue then is that the specific techniques that therapists use to try to help their clients remember repressed memories are the same techniques that produce false memories for events that never actually happened. The fourth piece of evidence is that implanted false memories can change people's attitudes and behaviors. For instance, in one study, subjects were implanted with a false memory about them getting sick after eating a certain food when they were a child. Among other things, the researchers found that after implanting this false memory, people showed a reduced preference and ate less of that food compared to a control group. The implication of this finding is that just because someone has a negative emotional reaction to a person, along with a memory of abuse, that doesn't necessarily mean that the abuse was genuine. Because again, even false memories can change people's attitudes and behaviors. A fifth piece of evidence is that many claims of abuse based on recovered memories are later retracted, and others are extremely implausible. Retraction isn't necessarily proof that no abuse occurred, but it is telling nonetheless. There have also been cases of patients successfully suing their therapists for malpractice after developing false memories of childhood abuse, suggesting that their therapists caused them to remember events that never actually happened. Some other examples of spectacular memories recovered in therapy involve alien abductions, abuse remembered during past lives, and satanic ritual abuse, which again presumably never happened. And then the sixth piece of evidence is that people with recovered memories are more likely to form false memories in laboratory experiments. Ultimately, this suggests that people with repressed and recovered memories are just more susceptible to forming false memories in general. And there are other pieces of evidence as well that are discussed in the 50 Myths book, so make sure you learn these also. And finally, to bring this back to the paper, this is the point where you would evaluate the quality of the evidence that supports claim number 2. So if you want, think of any comments you have about this evidence and post them in the discussion board. And finally, in the conclusion section of your paper, you should discuss which claim you think is supported by the best quality evidence, which for me is the false memory claim, and why you think it's supported by the best evidence. For example, you might restate the strongest pieces of evidence to support that claim, which I've done here. All right, that's it for me.